The two most common complaints are pain. Number two complaint is it's unstable. The biggest problem I get when the patients come back is they have pain on the side of their knee, or the pain there where the metal doesn't match and is rubbing next to their tendons and ligaments that run right by the bone in that area. And if you have metal or anything that's just overhanging just a little bit, that can rub on the tissue, and they always have pain and problems. The complication rate with total knees across the board is about 20 or 25%, not perfect. Now it's usable and they come back, but it hurts, it bothers me, and they're not happy with it. That's 20 to 25% by every single study. You don't have that with a Conformis knee. And it makes sense. If you had your knee all your life, why am I going to change it and put a knee in to make it fit you? We ought to have a knee that matches your knee. It just makes common sense, and it'll work better. And that's what we offer in it, and believe it or not, it works. The first time I used this type of knee, Conformis, I was hooked. You sit there and think to yourself, why do we have anything like this before that matches things? That's our biggest challenge in orthopedics on the knee, is matching, and the match was perfect. The biggest problem we have with all the other knees that we've done is getting it perfectly in. All we can do as surgeons is make it perfect into the bone. That was almost impossible across the board. What this allows you to do also, and one of the biggest problems that surgeons have, is balancing and getting the rotation. When we put these components on, we don't just put them on, they also have to be rotated perfectly. Because this is computer generated to the patient, and the patient's mechanics in terms of how their knee works, because it matches the bone, it allows them then to get the mechanics back, because what you're doing most of the time with the other companies, you're going like this and putting it in right. This one matches perfectly. It's already fitted where it's supposed to go, where that rotation is, and it matches perfectly every time. The most important thing is balancing and getting the kinematics of the knee back. It has to do with how the patient feels and the stability of the knee that makes it. You match the joint lines, you're not cutting too much bone. That happens in all these other companies all the time, and then you're scrambling on the table to try to rebalance it. This doesn't, it's precise, you put it in, you trust it, and it works. Three of our patients that have had knees on the other side, we put Conformis on because they came and said, I want something that's newer, state-of-the-art. The other one doesn't quite feel right. I can get around, it's okay, but it bothers me now and then, and I can't do things, and it just doesn't feel perfect. And we put their knee on the other side, and all three to the point came back and said, this knee's better. I like it better, I can flex it better, and I trust it. So, I mean, I can't say any more than that what the patient says. And the patient comes back and they love the knee.